All right, let's talk about something that confuses a lot of patients. The mini facelift versus the deep plane facelift. You've probably seen ads for lunchtime lifts, weekend lifts, band-aid lifts, mini lifts, and all of these promise huge results with minimal downtime. But here's the honest truth. There's actually no scientific or anatomical procedure called a mini facelift. It's a marketing term. And I know this because I used to do a lot of them. From about 20 years ago till about 10 years ago, I performed what I called a mini facelift. Scientifically, this is really a SMAS plication type facelift. This included a limited amount of skin dissection, getting underneath the SMAS, doing a little bit of dissection of the SMAS, pulling these structures back, closing it, and then trimming the excess skin. First, let's actually talk about what we're lifting in a facelift. A facelift isn't just about skin. If you only tighten skin, you get that tight, pulled, unnatural look, and it doesn't last. Underneath the skin is a layer called the SMAS. The SMAS is a fibrous support layer that connects the muscles of the face into the underside of the skin of the face. I didn't fully release or mobilize the deeper layers underneath that SMAS when I did a SMAS plication mini facelift. So instead of truly repositioning the face, what I was actually doing is tightening the face. So let's take a look at this model right here. So in this model, you can see the facial muscles right in this area, and the SMAS would envelope this, and the skin would be on top of that. So I would essentially dissect out the skin to about right here, make an incision in the SMAS, dissect the SMAS from about here to here, pull the SMAS over, resect any redundant SMAS, pull the skin back, and resect some of the excess skin. And that type of procedure worked okay. However, one of the things that I noticed as I was doing these type of procedures was that it really didn't stand up to the test of time. As I saw these patients 7, 8, 9 years later, they were right back where they started. And I started questioning what it is that makes this lift not last so long. What I realized is that what I was doing was that I was simply pulling on the SMAS layer. Now you actually have ligaments in different structures that go from the underlying bone of the skull all the way through to the SMAS layer. So those ligaments are called the osteocutaneous retaining ligaments. So unless you released those osteocutaneous releasing ligaments, those ligaments would be pulling against you. So you can pull as hard as you want, but over time those ligaments would win. Now, if you really wanted to pull so hard that you offset those cutaneous ligaments, you would end up with a very, very pulled look. Both of those were suboptimal for my facial rejuvenation patients. So what did my mini facelift actually do? I had a limited skin dissection. That just means that I didn't lift a huge area of skin. I kept it minimal. I did a limited SMAS dissection where I dived underneath the SMAS, but what I didn't fully do is release and mobilize that entire deeper layer. So instead of lifting all the attachments of the SMAS to the underlying musculature, I was only lifting a portion of it and tightening as opposed to repositioning the face. And here is where my opinion has changed over time. At first, it seemed really appealing. It was a very quick surgery, patients were happy, shorter surgery, less downtime, very easy recovery. But as I followed my patients long term, I started noticing something. The results just didn't last the way I wanted them to. And more importantly, they didn't always look as natural as I expect from my work today. This is where deep plane facelifting comes in. Instead of tightening the SMAS layer, A deep plane facelift releases all those retaining ligaments and allows me to lift the face and reposition it as a singular unit. There is no tension on the skin, so the key difference is this: mini facelift equals tightening, deep plane facelift, repositioning. As I've evolved as a surgeon, my priorities have become very clear. I want natural results, longevity, consistency, and I just wasn't getting that with minimal dissection techniques. So today, almost every facelift I perform is some variation of a deep plane facelift, because unless I release those deeper structures, I simply can't get the result that I know is possible. Now, to be very fair, there are patients who think they need just a mini facelift. Usually they're younger, have earlier signs of aging, and want something subtle. But here's the reality. Even in those patients, if I want a natural contour, a lifted jawline, a smooth transition from face to neck, I still need to address those deeper structures. It's not something that I can just overlook. One of the biggest misconceptions is this: I don't want anything aggressive. And I completely understand that, but a deep plane facelift is not about being aggressive. It's about being anatomically correct. Ironically, it looks more natural than a limited facelift. So when you're deciding between a mini facelift and a deep plane facelift, the real question isn't which one is smaller. The real question is which one is actually going to give me the result that I want and make it last. For me, based on my experience, that answer is almost always some form of a deep plane facelift. If you're considering a facelift and you're not sure what you need, the most important thing is finding a surgeon who understands facial anatomy deeply, has evolved in their technique, and is honest with you about what will actually work. If you found this video useful, please give us a like or a thumbs up. Give us the subscribe. If you have more questions, please reach out to us on any of our platforms, and I will try to help you out by either posting another video or getting in touch with you personally.